I chose speech therapy because I was working with singers that were having vocal problems. And I learned that when you want to help singers with vocal problems, you end up in the world of speech-language pathology. We're talking language, speech, articulation, voice, swallowing, alternative augmentative communication, basically anything that involves communication. I see everything from somebody who has had a stroke to somebody who is noticing changes in their voice due to aging or due to possibly a neurological diagnosis like Parkinson's. I also see patients that have head and neck cancer and are dealing with swallowing difficulties post-chemo and radiation. I also actually see some pediatrics, some of those little kids who are having problems with just learning language and figuring out language. Another fun little part that we get to do is cognition. So when everybody thinks, oh, it's okay, I'm forgetting things because I'm getting old. Well, no, we can help teach you some ways that you can kind of keep your brain going and some exercises to keep things going longer and stronger for you. I actually see most patients with hearing impairments that I see are with phonological processing. So dealing with the processing of the information coming in, not necessarily the hearing. Our audiologist team gets to work the magic for them. The patients benefit from having this type of continuum of care is that it's seamless. We are able to talk to their doctors, we're able to talk to their other therapists, we're able to find those little things that might have been dropped in other places. If you work at a private clinic, you might not have easy access to their doctor to be able to ask those simple questions of, what about this medication? Can you tell me a little bit more about it? Or you might not be able to talk to the radiation oncologist and ask those questions of what some of the adverse effects of their radiation may be in terms of their swallowing. I absolutely adore working at Riverside. It's a system where I feel the love all the time from my patients, from my management team, from the upper staff, from the hospitalists. It's such a great connection that we have, and communication is so nice between all of the systems. Communication is huge in my world. Well, I communicate, but communication is huge for me because I need to know what a patient's diagnosis is. I need to know how a patient is progressing, either positively or negatively. And that communication with those physicians and those team members is key to our patients being able to have the successful journey that they can have.